Hi, my name is Madison and I'm a registered veterinary technician here at Rosemary Pet Hospital. And today we plan on showing you a few things that we do on a regular basis to help take care of your pets and to keep your pets healthy. So this is our treatment area where we take care of most things such as vaccinations, drawing blood, heartworm testing, all kinds of simple procedures and things that are very normal to do on a regular basis for your regular wellness and preventative care for your pets. Over this way, we have our surgical room. In this room is where we do all surgical procedures, from simple spays and neuters, which are very highly recommended, to bigger procedures such as orthopedic surgeries, as well as emergency surgeries as well. So this is our x-ray room. This is where we do x-rays. So looking for broken bones, checking for different abnormalities, checking chest. We do all kinds of diagnostics using our x-ray machine. Over here we have an x-ray of some of the things that we do. This is a dog that was not spayed that ended up with pyometra, which is a major infection in the uterus. Things like this, if not taken care of, can kill your pet, which is one of the reasons we strongly recommend having all your pets spayed and neutered. Right next to it, we have our blood machines. These are used as diagnostic tools to run blood work and check for different issues in the blood, as well as check for any abnormalities and to make sure your pet stays healthy. So this here is Dio. He is a 16-year-old Queensland healer of mine, and he's actually due for a vaccine today. Vaccines are important because they help protect your dogs against things that are contagious, that are either carried in the environment or also carried by other pets. So it's important to protect them to make sure that they stay healthy. Today, Dio is getting what is called his distemper parvo leptospira-influenza vaccination, which is also abbreviated as DA2PP, DHLPP, has a bunch of different abbreviations, sometimes known as a combo vaccine. These are recommended every year unless you opt to do a 3-year vaccine, which is available. So today he's going to be getting a little poke, does not hurt them, and it's very safe to do and super fast, which I'm going to demonstrate for you today. So first off, I've got my vaccines that are refrigerated. We're going to draw them up. So you have to mix them because they come separated to make sure that they stay nice and active. So I'm going to draw up what is called a diluent. Add it in to the powder, which is the actual vaccination. Give it a nice little mix there. Then we're going to go ahead and draw that right back into our syringe. We're then going to change our needle to ensure we're not poking him with a dull needle and that everything is still sterile. So these are usually given in the right front shoulder subcutaneously. Most vaccines are given in the same area per vet hospital so that everyone knows where the vaccine was given. So if there's any type of reaction, you know what vaccination it was. All right, Dio, are you ready for this? You're a good boy. So you're gonna find a little loose skin here. You're gonna poke and inject. Little rub there because it can be a tiny bit tender afterwards, and that was it. So one of the very important things, especially with our older senior pets, is nail care. The reason being is if they have longer toenails, it readjusts the way their foot rests on the ground, which can make joints hurt and make it more painful for them to walk. So making sure that their nails are nicely trimmed is a great way to help prevent that. So I'm going to demonstrate trimming nails on Mr. Dio here, okay? So you want to make sure you don't get the quick, okay? And it's kind of that pink thing you see running through there. So all you're going to do is grab the nail at a 45-degree angle and cut right through. I like to Dremel nails, which helps to prevent from that sharp edge. So this here is a Dremel bought off Amazon, works amazing. And just like that, that nail is all taken care of. Oh boy. So this here is one of our patients. This is Miss Granny. She was sent to the emergency overnight for hospitalization because she's not feeling very well. And since the overnights are closed during the day, she was sent back to us to take care of her. So she'll be spending the day here with us on IV fluids to help support her blood volume and to help try and get her feeling better, as well as receive medications and special food to help her. As you see here, she does have an IV catheter in. This is just like the ones that we get at the doctor or the hospital, and it gives us access directly into her blood system to make sure we can administer any medications and fluids that are needed to help support her until we get her feeling better. So I've been in the veterinary field for 17 years now. Ever since I was a very young girl, I had always planned to work with animals. I had always had a passion to help care for animals. When I was about 5 or 6 years old, I had a horse that had a tragic accident, and I had promised him I would always take care of animals, and I've done so ever since. I worked really hard to get where I am, to get my license and be a registered veterinary technician, and I definitely feel it was well worth it. I get to do all kinds of things, from helping animals feel better, helping protect puppies, helping to keep pets' teeth clean and clean their teeth just like your dentist does on a regular basis. I get to play with puppies. Yes, there may be some animals that aren't always the sweetest, but it is a very rewarding job to be able to help innocent animals who cannot speak and tell us what's wrong and to make them feel better. What are some of the things that you guys like to do with your pets? Do you know if your pets have been vaccinated regularly? Why don't you take a time to talk to your parents and ask them if they're up to date? Thank you so much for your time coming and visiting with us today. I hope to see you all soon with your pets to get them vaccinated and all the care that they need. Feel free to call us anytime.